of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me here, guys. We have been doing a series of episodes on the topic of scope modernization and optimization. Short, sweet, quick little bites that you can help you think a little bit differently about this conversation. I know it's been a lot of conversation about scope, but well, I want to have these different conversations so each of us will think about it a little bit differently and understand why it's so important for each of us to do a little bit more to help our profession to continue to grow. Before we dive in, I want to say a big thank you to CAO. We are in Halifax at the Halifax Convention Center here for the CAO Biennial Congress. And I want to say thanks to CAO for giving us this space to have this conversation. My guest is the wonderful Dr. Mark Eltis, who is a director of the ABO and the president of the College of Optometrists in Ontario. Now, while he is the president, this conversation is not in that capacity. So he's going to be taking off his president of the College of Optometrists hat off, and we're going to have a little bit more of a candid conversation with Dr. Mark Eltis with all of your experience and expertise in the industry and related to scope. So thanks, Mark, for being here. Appreciate it.
My pleasure. Thank you for having me again.
Absolutely, absolutely. This is, I think, such an important topic, maybe the most important topic in my mind right now for us and our colleagues in Canada. Multiple provinces have some sort of a plan or a proposal ahead of government right now in their provinces. The CAO is having conversations at a more national level with different stakeholders and entities. What's your take on scope optimization? Why is it important?
Of course. So it's so important because it's for the patients. Ultimately, it's for patient care. And I see no contradiction between, expanding the scope for optometry and protecting the public, because by virtue of doing this, by expanding the scope, we are actually helping the public get access to care, which is what everybody wants, both the patients and, of course, doctors want to help. When we see a patient, we want to offer them everything we can possibly offer them to care for them. So it's not really practical for a patient to be told, well, you need this. I could do it, but I'm not allowed to do it, and you'll have to see someone else, and you'll have to wait months to do it. And the person who will do it, that's not the main thing they would like to do. They actually do much more advanced procedures. So everyone in this case suffers because the patients who need the advanced procedures have to wait because a specialist will be bogged down doing something simpler. And the optometrist who could do it can't do it, and the patient who needs it can't have it.
Yeah, that's a really great way of looking at it, I think, is that protecting the patient and the public, looking at it from that perspective really helps, I feel like, flip a little switch in your mind, right? It's not just for us as optometry to grow, it's actually to provide our patients with the care and protect the public so they can get timely care in this aspect. Now, what are if you can share, if you have any off the top of your head, things that where are some aspects of our current scope where we're a bit limited or we're asking for, maybe in Ontario specifically, or across the board?
Well, I mean, I can speak for Ontario in the sense that, even for glaucoma, some basic procedures that we should do, it's not really at the moment on the table, if you will, so that needs to change. I can say generally, obviously, that I love the working relationship that we have in Ontario. The college, the association, and the school work together beautifully. Tripartite group, I've been involved. It's fantastic, and I think the government has been very good at listening to us, and I think we should be optimistic about the future.
That's excellent to hear. Excellent to hear. I think the phrase that I think goes a long way is education before legislation, and I think Waterloo, of course, is doing a very good job of educating all graduates to a certain degree, beyond our current scope, of course, to an extended scope, so that government can see that we are trained and capable and have the skill set.
Exactly, and there's courses being offered, for optometrists who are already graduated to refresh and to prepare. That's fantastic. And even at the CAO, I was at a meeting at OLF, and they were showing, on display some of the procedures. And there's some trailblazers. I was just listening to Dr. Sophia Leung, and she was speaking and showing, and it's wonderful. And I learned a lot. And zapping, I felt like I was on Star Wars.
You did it?
Yeah.
That's excellent. Yeah, the advanced procedures course is great. So I think that's really important for our colleagues to know. It's, of course, the students coming out of school now are getting hands-on experience with all of this, but somebody like myself who graduated 15 years ago, I didn't have access to anything back then, but certainly I'm excited too. I'll be taking one of these advanced procedures courses in the near future because I want to be able to speak to it. Even if I don't do lasers in my clinic, if we do get scope, the modernized scope that we're looking for, I may not do laser type procedures in my office, but I'd like to know how to do them. I'd like to know what's involved, and I'd like to be able to talk to my colleagues, our colleagues, and encourage them, like, this is actually something certainly more than doable for us. And Sophia is a perfect example, having had hundreds of procedures under her belt, if not thousands. She and Sarah McIver, who come on the podcast before, were talking about this is well within our wheelhouse. In many cases, we're using the same tools that we use every single day. We're not asking optometrists to go out and learn how to do some, advanced refractive surgery or some other procedure that's never been done for us. We're using a slit lamp. We're using forceps. We're using, different tools that we're using day in, day out anyways.
Yeah, that's what I want to add too. It's optometry and ophthalmology use the same materials, they use the same techniques, they use the same everything, same textbooks. So the thing is that it's not like there's a difference of philosophy. It's the exact same procedures. So that's something which should be, I think, clearer to the public and perhaps medical professionals, that we don't want to do something that's out there. It's not a difference in what we're going to do. It's not a different technique. We want to do the same techniques. That's how we're educated.
Yeah.
We believe in the same, treatment protocols. It's simply a matter of implementation. And sometimes perhaps we're even a little more sensitive to things like dry eye. If you change something in the lid, that you don't want to cut meibomian glands. We're more attuned because we deal with it on day in, day out, the dry eye that isn't as common to be dealt with in ophthalmology. So that's something I think which is important to keep in mind.
I think that's very important. Actually, that's a very important thing that you said there is to help any of the stakeholders or anybody who might be watching this, even if a patient's watching this and asking, well, can an optometrist do these treatments and these procedures? Well, our philosophies and all of the bases, the foundations of our medical training and the procedures for treating glaucoma or whatever disease, they're exactly the same. We're not looking to now treat patients in a whole different way with a whole different algorithm. It's the exact same algorithm, it's the exact same machines.
Exactly, and one of the things is the responsibility of the individual practitioner. I'm not a cowboy. If it's something that's beyond my abilities or my general knowledge, I'll refer.
Absolutely.
And the same thing in optometry. I don't do a lot of binocular vision. I don't do low vision rehabilitation. I'm not going to do it. I know the limits of my knowledge. And that's actually one of the important things about doing advanced training, like doing a fellowship or board certification, is that you realize how much you don't know, how much you didn't learn, not because school is bad, but because you were overwhelmed in school with everything you had to learn.
Yeah.
So when you start writing a paper, you learn incredible amounts of things about that topic. You're like, wow, I knew so little. Or you understand how little you knew in terms of what could happen, so that there is different possibilities. And that's why sometimes even when I'm cautious with glaucoma, I was just speaking to a colleague that, well, I know what could happen. That's why I don't necessarily sometimes do one course of action, because I know the gamut of possibilities. And that's where scope right now is restricted, speaking from Ontario, that we can only treat a certain type of glaucoma. And so I know, well, if something changes, that could change the perspective on the case. So these are the reasons why we'd want more of expansion of our ability to practice, and even with medication, because there's a limit to what you can prescribe. Well, if you're limited in what you could use, but you know that you'd want to use certain tools, well, that is a very big problem to have. So we want, and I know we were talking about lasers, and of course that's in the scope expansion that's on the table. But aside from shooting for these kind of procedures, there's also the simpler procedures that are still not available to us, and especially with drugs and with other simple things for day-to-day glaucoma diagnostics or foreign body removal.
Absolutely, absolutely. So there's a lot of work to be done, but hopefully, as you said, we're heading in the right direction, and there'll be some positive movement across the board in every province over time. Any final words you want to share on this topic, scope modernization?
I think it's an exciting time to be in school. I was just thinking, of course, we're here taking lectures, and I was thinking how optometry's changed in the last 20 years. I know, I'm dating myself now. Sometimes I still look like I'm 12, depending on the day or what I'm saying. But think about the changes. I mean, OCT was something, if you told me when I started optometry school about OCT, I'd be like, wow, this is like out of Star Trek. And a lot of things, just like with technology, we have iPads, which came out of, I think, start watching Star Trek: The Next Generation, all the kids that watch it now produced it. Right. Same thing with optometry and medicine. I mean, you think about a scanner of your optic nerve, or we're going to fix this, we're going to prevent myopia. This is stuff that was like out of Captain Picard and the Enterprise, and now it's real.
Now it's real. It's all real. So our profession needs to evolve with all these new advancements in medicine, and of course we want to be able to keep up with the changes in our population and the demographics. And this is another part of going back to what you said, is just being able to serve our patients and provide them with the care that they need.
And with that, I would say, serving our patients is also referring to our colleagues, which
Yeah.
I think we don't do enough of.
Absolutely.
And I do that, for binocular vision, for other things. And why not do that? Because we have our colleagues who are really advanced, have had advanced training, who have done all kinds of extra work, who have the experience. Why not collaborate? And patients appreciate that.
Absolutely, they do. I think it's a win-win-win on that one. The patient gets the care they need. The profession looks better, looks more tight-knit and stronger serving our patients. I think it's a win all around. So thank you, Dr. Eltis. I appreciate you doing this for us, this short little snippet. I know you wanted to do a longer episode. I'll have you back on. Have you back on for another one soon. But thank you again for sharing your thoughts, and thank you again to the CAO for giving us this space here in Halifax at the Convention Center.
Martin did an excellent job as president, and I'm sure there'll be excellence going forward.
Absolutely, absolutely. I'm going to be talking to Martin shortly, actually. So we're going to be talking about him and Allison, who's coming in now as the president.
Amazing.
So thanks again, everybody. Thanks for listening and watching to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys soon.